Let's start with the grounds for optimism. These are drug deaths over the years, and if you look at the last 2 years, it does look like there is a sustained drop, not just a pandemic effect. That could be the start of something. But compare it to where we were all the way back in 2000. It's still a lot higher. It grows, it grows, it grows. It really takes off in 2013. Now, to understand why that happened then and where Scotland might be going, we can look at the types of drugs involved in deaths. This chart shows how many deaths were a result of different classes of drugs. And you can see that in 2013, it coincides with the rise in benzodiazepines, sedatives like Xanax and Valium. Now, opiates have always been the most deadly. They remain that today. But a rise in the abuse of multiple drugs at the same time has been a big factor since 2013. More than 9 in 10 drug deaths are caused by users taking a combination of more than one drug. But again, good news. We can see the drop in all those lines, and actually cocaine was the only main drug class to increase its contribution to death this year. So hopefully the start of a promising trend. But Scotland is still in a very bad place compared to other nations. Most European countries are between 30 and 90 drug deaths per million people. Scotland, all the way out there, 248 drug deaths per million people. If we go back into the data in a bit more detail, there's a couple of worrying trends hidden in it, like the differences between men and women. 26.6 men per 100,000 died last year of drug misuse. Now, compare that to women, it is lower at 13.3 per 100,000. But we need to look at the rate of change. Since 2000 over here, the number of men dying has tripled. The number of women dying has gone up 7 times. Or take a look at age. You might assume that younger people are more likely to die from drug misuse. But actually, we're seeing a drop in those younger groups, which is good news. For those who are 55 and over, the so-called train-spotting generation, here in blue, they're seeing sustained increases. If we look at the geography of the problem, there's more concern. Dundee has been at the epicentre for years. It's now just been overtaken by Glasgow. And that speaks to another trend, a growing inequality between the most and least deprived areas in terms of drug deaths. If you go over here on the left, these are the least deprived areas. And then when you go up along here, you can see the deaths are increasing along with deprivation. You see Glasgow and Dundee there. And the single biggest structural driver of problem drug use is poverty and deprivation. That's mirrored in the deaths from drugs too. So it is a complex picture because this is a complex problem and it's one that isn't close yet to being solved.